Okay, so we have time for some questions, and who would like to go first? Okay, I will. We've been discussing the prevention of weight gain by physical activity, and these longitudinal studies are particularly important, especially as people age. So my first question is more biological. Is there a survival advantage to keeping weight absolutely constant through middle age and after the menopausal fairy pays a visit? Is that, I mean, do we really want to be preventing it, or are we really interested in attenuating that curvilinear shift that occurs?
That's an epidemiological question.
Oh, okay. Then I'll refer to...
Well, I suppose you are the one who's the best person to answer that question.
29, so it doesn't...
No, but no, I mean, what I think is important and I can only speak to the data I'm aware of and the data we have, and I didn't show that data, but we also looked in this MRC-ELI study where we looked at physical activity, whether it was associated with gain in adiposity and both in fat mass and in fat-free mass. And we looked at over a period of about 5 years. We did have data on follow-up, both fat mass and fat-free mass. And what we found in that study was actually that there was an interaction with age. So those ones who were younger than 50 or 52 years of age, there was an association, so higher levels of physical activity predicted less gain in fat mass. But it was the other way around in the elderly. So those in the elderly, we saw that higher levels of physical activity was actually positively associated with weight gain, but it seemed to be associated with fat-free mass. So in the elderly, being physically, elderly, I mean above 52, it's not the elderly.
Thank you.
But sorry. If we extend it, sustain a high level of physical activity, I would say preserves fat-free mass. And I think that's tremendously important for a number of different health outcomes. And also, I suppose, being physically active throughout life should be more, and in the elderly, should be more focusing on independent living rather than body composition and adiposity.
Thank you. Dr. Salas.
Hi, thank you for the interesting presentations. And my question is really about the same theme. And maybe mainly for Ulf, but Robert, if you'd like to address this as well. You phrased your questions as related to body weight mainly, or obesity defined by BMI. But for Ulf, the most positive, or I would say encouraging outcome that you reported was on waist circumference. And so my question is, would your conclusions be different if you phrase the question as related to body composition or body fat, rather than weight related?
I'll take a. Again, if I mean, there's absolutely no question, and we and many others have shown it. You will see a reduction in adiposity, an increase in fat-free mass. You'll see a reduction in cardiometabolic risk factors, and just about any other good thing you want, you'll see an improvement in the absence of change in body weight. And I've been a big proponent of that, and maintain that position. And we'll hear some more thoughts on that this afternoon. But I think in in the longer term studies, in the 5 and 6 year intervention studies, and I'll let Ulf speak to the population-based studies, it's going to be harder to use those criterion measures. But I think sooner than later we'll see waist circumference start to be side by side with BMI, and I think we will see reductions in waist circumference in longer term studies independent of changes in body weight. I think we'll begin to see that.
You want me to comment, Jim?
Yes, I would like you to comment, because I think, you could easily get the impression, well, in the epidemiologic studies, physical activity really doesn't matter for weight.
Yeah, I think it's important to notice that almost all data we have from observational research have measured body weight, BMI, and in some studies there are measures of waist circumference, and there are very few studies, at least large-scale epidemiological studies, with measures of body composition. And I agree there might be, the studies, or the few studies I'm aware of, actually show, as I said, a differential effect by age on fat mass and fat-free mass, showing that physical activity was positive for maintaining fat-free mass in the elderly. So I suppose we need, much more data, observational data, where we have very good measures of both the outcome and the exposures. And it's actually, as Kathy showed, we have more data in children with objective measures of activity and more robust measures of body composition. But those studies are fairly small, compared to the very large epi studies. And just one more comment for the waist circumference. Although we observed in that study a significant association with waist circumference, I would actually question whether it's clinically meaningful, because it was so minor. It was 0.2 millimeters per year in waist circumference. So, it's nothing.
Doesn't anyone use the abdominal circumference? Am I the only? Around the umbilicus?
But that's waist circumference.
Huh?
That could be waist circumference.
It could be, but okay. We'll continue. Next question.
Hi, thank you. My name is Martha Brady. I'm a researcher at the Population Council, which is an international NGO working in the developing world. And I work in different areas, but a couple things strike me. Thank you very much for those talks. They were excellent. Fundamentally, some of the things we're looking at are behavioral change, right? Behavioral change. And one of the things that we've observed is that the more social change that's required to get a behavior to change, the harder it is to do. So I'm wondering if you've looked at all at sort of indigenous things that help people do the behavior that you want. For example, in behavioral economics, we look at nudges and tweaks, and I'm curious to know whether any of that is being done in this arena, if I'm making myself clear. And the other question I had was, do you look at all at from a public health point of view, at tipping points? Where in a community do you see, let's say, for example, if you see 30% of a community now physically active and moving, does that then change, does that then do anything on the epidemiology of an epidemic? No.
Yeah, I'm going to start with your second question first. I think your first question was one of behavior, and I will let the behavioral people later on today speak to that. I think, and this follows along on Dr. Salas's point, that everyone submits on the benefits of physical activity. And we have shown you very clearly that if you engage in exercise or physical activity, if you do it, you will gain those benefits. You'll reduce waist circumference, you'll do all of that. I'm not aware of any models that we have right now that basically show us absolutely that you can sustain a model that used to sustain physical activity over 2, 3, 4, and 5 years. I think we're getting better, but we're just not there. And the other thing in the studies that I reviewed is it's just extremely hard with the tools we have, especially nutrition, mean, the accelerometer is doing much to improve our understanding of that exposure. But self-reported dietary intake, as you all know, is very, very difficult. So I'm not sure how we're going to tease that out. So 2 points to your second question. One, we don't. If someone says, geez, does physical activity matter with respect to weight or body fat or waist circumference or whatever? What you're really asking is, do we have a model that I can point to say the majority of people who adopt this behavioral strategy will be here at the end? My understanding is that we lack that. That is not the same as saying physical activity is not important. It's very, very different. We have experimental evidence that shows us that, and Jim spoke this morning about the irrefutable evidence, the importance of exercise and physical activity with energy balance. But we have to bring that into a model that we can look and sustain for 4 or 5 years. And I don't know. We're still working on that, and I know we're getting better, but we've got a ways to go.
Can I just simply add? I wholeheartedly can only echo what Robert says and what we heard this morning. I mean, physical activity is fundamentally important for public health, even if the epidemiological data may suggest that it may not be that strong predictor of reducing weight gain or preventing weight gain. And I mean, some of the data I showed, it definitely prevents development of obesity, if that is the outcome.
Kathy Jans, University of Iowa, really nice presentations. And just to be clear in terms of the intervention literature, when you're telling me sustained, you mean that physical activity was sustained. So if people managed to keep their weight off, it was because whatever you taught them to do, they continued to do it, and that they did it as often as they did it during the intervention. Is that true? I'm just wondering what is sustained when we talk about follow-ups in RCTs.
Well, in our own studies that we've published with 2 and 3 year studies, sustain means, yes, the continued adoption of physical activity, right, that we've seen. It's been very sobering, even on our own work, randomized control trials, looking at the effects of lifestyle intervention on, we don't generally have body weight as an outcome, we have many more other outcomes, but we see we do very well when there's contact between the interventionist and the participant, and they are maintaining their activities. This is either by pedometer or by self-report. But when they start to lose the contact, we see an erosion of benefits. So yes, to your question, that's what I mean. The sustained adoption of the behaviors that you're instructing them to change, or as Ulf would say, the exposures.
I want to thank you for your attention this afternoon.